Hey guys, welcome back to my channel. So today I wanted to make a video about how to give report to another nurse. So how this is how I do it, and this is more on like the medical floors. So now I know like ER is different, and uh ICU is kind of the same as what I'm about to do, but yeah, this is just more like on the floor. This is not like a OR report, ER, mother baby, like nothing like that. This is about adults on your med surg floor, on your tele, on your ortho, um, places like that. So what I do is I will start off with the patient name. I'll say, okay, this is uh, Bob Johnson. Uh, I'll say age. I'll say 55-year-old male, in room 50, a patient of Dr. Williams. He's a full code, so I'll give like code status. I'll go into whether or not he's on isolation or not. If he is, I'll say isolation of what, like if it's MRSA, I'll say MRSA of the nares, or in a wound, whatever it is. I will say what date that they were admitted and what they were admitted for. A lot of times, the initial diagnoses that you'll see when they first came in is either not what they're still there for, like it probably got changed, because down in the ER they'll give like an initial diagnosis, and usually it's changed. So I'll go into like why they're here, and then I like to go into like what brought them here. So I'll say on this day they came via EMS to the ED with complaints of shortness of breath, bilateral lower extremity swelling, diagnosed with COPD exacerbation, something like that. I'll also go into what type of tests, the more pertinent tests that were taken, and because I'm not going into all those labs, I'll go into labs that came back abnormal. So those are the only labs that I'll mention if they were abnormal, and like tests, I will go ahead and say that. I'll say patient had a chest X-ray and came back no pleural effusion or no PE. I'll do a negative. They had a CT that came back negative. So I will do that just to let them know that okay, they came in complaining of these issues. A MRI, a CT, a X-ray was done, and it came back negative, or it came back showing some abnormalities. I will say all of those that were done. And then I will usually go into, like once I've done all that, I'll usually go into our current plan for them. So the plan for this patient is to give Lasix 40 milligrams IV, to help with the COPD or whatever. So I will usually do that, and I'll say usually you can find when the doctor plans on discharging them, and I'll say the plan is to discharge them in a couple of days, depending on how the patient is doing, blah blah. Then I will go into other history, like other health problems that they have, not necessarily have to be related to this current situation. I'll say history of hypertension, GERD. I'll say whether or not they are diabetic or not, or in ACHS, which means to check their blood sugar before meals, before dinner and breakfast. So I'll say that at that point. The next thing I will go into is important medications that they're taking. A lot of times, us nurses like to know what type of antibiotics they're on, if they are on any, or if they are on any cardiac drips, and whether or not they're just like at one level, then are they going to be titrated or not? Are they on a Lasix drip? How fast is it going? Whatever. So I usually say important meds. And then like with antibiotics, those are timed. So it's just nice to let the nurse know, like, yeah, they are on Vanco. So then the nurse would know, okay, so I'm I'm really have to look out for when these antibiotic times are, so I can give them on time. Once I've done all that, then I'll go into like the little brief head to toe of the patient. I'll start with the neuro. I'll say their learn oriented times, whatever. If they're oriented to, person, time, place, situation, I'll say learn oriented times 4. If they're not, I'll say, they're disoriented to situation or whatever. Then I will go into their cardiac. So are they normal sinus rhythm? Are they AFib RVR? Are they tachy? Are they Brady? Do they have any heart blocks? Are they hypertensive? Are they hypotensive? So I'll go into all of that at that point. Then I'll go into the respiratory system. So I'll say whether or how the lungs sound. Are they clear up top, diminished in the bottom? Are they clear and equal bilaterally? Are they on room air? Are they on oxygen? How much oxygen? Are they on 3 liters nasal cannula? Is an oxygen humidified? So I'll say all that at that point. Do they have a cough? Do they have any shortness of breath with exertion? Are they wheezy? Yeah. Do they need breathing treatment? Stuff like that. I'll say all that. Then I will move on to like mobility or musculoskeletal. How do they move? Are they on bed rest? Are they up with a standby assist? Do they use a walker, a cane? Are they a total lift? Yes. Then I will do like the genitourinary part. So I'll ask, and like the digestive. I'll say how their bowel sounds are. Are they audible and active in all the quadrants? Do they have positive bowel sounds? Are they passing gas? When was their last bowel movement? I'll put that on there. How was that bowel movement? Was it regular? Was it diarrhea? If it's diarrhea, is there C. diff in it? So I'll go through that. Do they have a Foley catheter? If so, how much urine are they getting out? What color is it? Does it smell? Is there sediment in it? For guys, do they like to use the urinal? Male or female, do they like to use a bedpan? Do they like a bedside commode? So yeah, going to that. Then I move on to skin. So what's going on with their skin? Are they edematous? They have edema anywhere? Is it pitting? Is their skin discolored? Is it ruddy? Do they have any wounds? Is there cellulitis? Is there pressure ulcers anywhere? If they are a surgical patient, where are the incisions at? So say they had to come in for a lappy, they need their appendix out. Where are the puncture marks on the abdomen? If they are a heart patient and they needed to get an artery or vein harvest from their thigh, their leg, where is the incision at? So I'll go into all that, any type of skin issues. Then I'll go into any dressings that they have, and what type of dressing is those puncture marks. Are they steri-stripped and then just that's it? Are they covered in gauze and Tegaderm, or transparent dressing? Are there any wound bags? If there are wound bags, what suction is it on? If there are chest tubes, where are they located? How much suction is it? How much are we getting out of each chest tube? What was my output for that? So I'll go into that. Next, I will talk about any like IV accesses we have. So do they just have peripheral IVs in the antecubital and the forearm? Do they have PICC lines? Is it a single, double lumen, triple lumen? Do they have intrajugular, central lines? Do they have ports? you know, for like dialysis or anything. So yeah, I'll go into any of that kind of stuff and kind of drains we got, or access, more access. Then also at that point, I'll also go into any IV fluids I have running. So I'll say, yeah, Bob has a 20 gauge to the right AC with normal saline going at 100 mils an hour. Then the next part, I'll go into their diet. So are they NPO? Can they have nothing by mouth? Are they just a clear diet? Are they general diet? Is it diabetic? Is it restrict fluids? Like, are they on the 1,500 milliliter fluid restriction? Is it like a 2-gram sodium restriction? Are they a dysphagia patient where the food is mechanically altered, so it's like chopped? Are they on thickened liquids? Is it nectar? Do they take supplements? So I'll go into that, and then I'll also say like how they're tolerating it. And then the last part that I talk about is like their pain. So are they having any pain? Where? You know, what are they normally rating that pain as? And what medications they have for the pain, and then how often they can get it. So I'll say like, yeah, you know, he complains of like chronic bilateral shoulder pain. He rates a 7 out of 10. He has Norco 5s every 6 hours that he can get. I last gave it to him at 3 a.m. He's due for another dose at 9, you know, just to let them know. So when he calls, they know, okay. So yeah, and then if there's anything else, like if something, you know, like weird happened, like with family or just, you know, other than that, I mean, that's pretty much what I do. And then I usually ask them if they have any questions for me, and usually they don't, because I really do try to cover it all without going too much. The other thing I want to talk about is how to receive report from another nurse. So if you're on the same type of floor as I just mentioned, like more, you know, floor nursing, these are things you want to know. So because it just helps you to get better prepared. Like, you're just now meeting this patient, and you're gonna have a lot of patients, so you're not gonna have a lot of time to like really read the chart and get in depth. So it helps if you can get a pretty good thorough report, if that's what you like. So just try to make sure you get this type of information, but before you start like asking that nurse questions, please give her a chance to tell you, because that is so annoying. I'll be giving a report, and then like I'll be on the cardiac part. I'll be like, yeah, you know, the normal sinus, blood pressure's good, and then she'll be like, okay, cool, how's his lungs? And it's like, hey, I wasn't there yet. You know, like, give me a chance to tell you. So that can be kind of annoying. So yeah, just give the nurse a chance to tell you. And then if she's like, you know, you good, you got any questions, then if she didn't mention certain stuff, then you can bring it up. But yeah, so I hope you guys find this video helpful. Let me know if, like, when you guys are getting a report, if there's other stuff that you say or that you would prefer to hear, if there was anything I missed. So yeah, I hope you guys like this video. Until next time, bye.